The importance of mental health has launched into the headlines as we all continue dealing with the pandemic and the crisis here in Texas. Since 2019, the amount of people completing mental health screenings has nearly doubled, with nearly 2.5 million people looking for help. Former U.S. Representative Patrick Kennedy and founder of the Kennedy Forum, and Paul Gionfriddo, president and CEO of Mental Health America, join us to talk a little bit more about the need for more mental health care support for all Americans, especially for communities of color. Good morning, gentlemen. Thanks for joining us.
Thank you
for having us.
All right, so let's first start off by talking about the importance of mental health. It goes without saying, this is a topic that is very important to discuss.
Well, it is because we all have mental health issues. We have brains, and just like every other organ in our body, that organ sometimes doesn't work optimally, just like the others don't. And unfortunately, we don't have a system to respond to that the way we have a system to respond to every other organ of our body, because we don't pay for mental health care. And traditionally, we haven't. I'm proud to have been one of those that sponsored the Mental Health Parity and Addiction Equity Act, which is now federal law that requires that mental health just be reimbursed, like diabetes, like cancer, like cardiovascular disease. If we just treated this as part of healthcare, we wouldn't have people feel so self-conscious that they were getting something other than healthcare when they sought therapy for their depression, anxiety, or whether they got screened for addiction or serious mental illness. It only makes sense to prevent these illnesses from getting worse. That's what we do in the rest of healthcare, and that's what we should be doing in our mental health care approach as well. But it begins with paying for this care. And I think we should just pay for it like we do all other aspects of healthcare. Let's include the brain in the rest of healthcare and reimburse it appropriately.
Absolutely. And Paul, talk a little bit about what Mental Health America is doing to help continue this conversation and get the people the help they need.
Yeah, we've had an online screening program that the data from which you cited, that 2.5 million people came during the course of the past year and looking for help, and more than 1 million people with depression or anxiety or psychosis. Patrick and I and a group of CEOs from across the nation have put together a unified vision that really starts with prevention, early identification, and goes all the way through to deep end services that really reimagines and revisions the system as it could be. And I think building around the needs of the people is the key here. And I think Patrick's pointed that out too, that what we've got to do is work from the needs of individuals and not be held hostage to the way that we've always done things before, because this hasn't worked for people in Austin. It hasn't worked for people, Texas as a whole, or the nation as a whole, and we can do a whole lot better than this.
Absolutely. You talk about the screenings and the people who have gone to Mental Health America for these screenings. Now, this isn't necessarily a bad thing. Is it just highlighting the amount of people that need help and are maybe finally coming forward now?
Yeah, no, I think it is a good thing, because a lot of people are really, particularly younger people, they're having thoughts of suicide or self-harm on nearly every day of the week. And I would much rather they come to Mental Health America, take a mental health screening, get some resources, than to act on their self-harm or suicidal thinking. So we are trying, all of us, to reach out and get more people involved with the services that we provide. But the bad part of it is there really are more people with a greater need right now than there's ever been. So we've got to accept both sides of that equation.
Right. Talk a little bit about the aspect of why communities of color are impacted so disproportionately in the mental health realm as well.
Well, as we've seen through COVID, communities of color are suffering much higher death rates than those of majority communities. And that's just been a function of a separate and unequal healthcare system that frankly has not made itself available equally to those of color as it has to the majority. And we have seen that not just in other areas of healthcare, but especially in mental health care. mental health is such a stigma. It really is even bigger stigma, frankly, within minority communities. So we have to get better access to cultural competent care, which means the minority communities need to see their fellows as the therapists so that they know that when they talk about their trauma, living in America where people are not treated as equals because of the color of their skin, they can feel understood because their therapist looks like them. These are the kinds of changes we need to make to the system so that it's much more responsive to all Americans, because that makes sense for our country.
Yeah, it's very small changes that can definitely go a long way. Real quick, before we wrap up, where can folks go to get a little bit more information on how to help and also how to get help?
Well, first of all, I think people can go to any of our websites, the Kennedy Forum's website, Mental Health America's website, and get basic information about how to help other people. But if people are looking to get help, they can use the crisis text line 741-741. They can use the SAMHSA 800 line. And it's really important that people recognize that there are resources out there.
Absolutely. Help is available. All right. Thank you so much, gentlemen, for joining us this morning.
Thanks for having us.